back. And now I recognize Mr. Peters, the gentleman of California, for his 5 minutes of questioning.
Thank you, Mr. Chairman. Thanks for the hearing. And thank you, Mr. Secretary, for coming. It's great that you're here. In your testimony, you note that the various challenges ORR faces in providing high-quality care for unaccompanied children calls for a whole-of-government approach. And for example, we heard about ORR's partnership with the Department of Labor to address trafficking, and I know that ORR works with state governments, including my home state of California, our home state of California, to resettle refugees and provide them with services. And I want to make sure that we continue to support this effort so that it's, the coordination remains helpful and productive. So, Mr. Secretary, can you tell us how ORR is working to improve cooperation with state and local governments? I think this came up a little bit before, but particularly with respect to connecting children with post-release services.
Congressman, thank you for the question. And I want to salute the folks in our state of California for their cooperation at the local level to work with us. When we had to stand up under very difficult and emergent circumstances back in 2021, facilities to be able to provide shelter and beds for children, we were able to work with the city of Long Beach, the county of Los Angeles, with the city of San Diego to stand up facilities. We had no choice but to use convention centers. We turned convention centers into a place for children to sleep, eat, get their care. All those things were done with the strong cooperation of the local leadership in those cities and counties. That's what we continue to do with, once we have released a child to a vetted sponsor, where we can, as we've heard, we try to do post-release services. Sometimes we coordinate, we work closely with the local government services that are there, and we will do everything we can to make sure that we're working closely with our partners at the city, county, and state level.
Thank you. I know Mayor Gloria appreciated the work of the federal government in that instance, and it was great we could all come together and use that asset, which, sadly wasn't being used for conventions. It was a really smart thing to do at the time. But I guess not all states probably are working as productively with ORR, and some states refusing to license ORR facilities in their states. When a state refuses to collaborate, what's the other side of that? How are children hurt? What is ORR doing to support children in states where you don't maybe have the same kind of partnership?
Yeah, we've had a couple of circumstances where a couple of states have actually try to de-license facilities that we use to provide care. We seek facilities that are going to care for these children while we have them in our custody that are licensed, that have gone through the process to receive a state license to actually offer care to children. We don't just care for these kids in a facility without people who are trained. Licensed care facilities we use where we can. And believe it or not, there are some states that are trying to prevent us from actually providing the care for these unaccompanied children through licensed facilities. It obviously harms the children if we can't try to protect them by having people who've gone through the licensing process. But what we've done is decide if they're going to shirk their responsibility, we're going to do what you would expect, which is to make sure that we abide by those standards that would be required of any facility that did get a license.
Children can arrive with complicated pre-existing conditions, some of which may be fatal, as unfortunately has been the case a few times this year. What do you do to ensure that all children in ORR's care have access to high-quality medical care? And again, this is something you talked about a little bit in terms of your ability to follow up under the current law.
Yeah, and that's where these licensed care facilities are so important, because they don't get a license unless they can provide that level of service, and in some cases, healthcare, medical services. We make sure that children receive the services that you would expect of any child. As I keep saying, kids are kids. We're going to treat them like your kid, my kid, anyone's kid. Children should not have to go through the trauma of being mistreated simply because people don't know who they are, have they not been around for a long time. And so we will provide whatever health care is available, both through our facility, and sometimes, as you mentioned, we actually send them to medical facilities in the surrounding area. Oftentimes, we have had kids who come with pre-existing medical conditions, and we have had circumstances where we have had children who are terminally ill come to our care.
Mr. Chairman, you remember Mr. Secretary, you remember the clock here. I'm running out of time, but I just want to say that I think everyone here understands that ORR has a heavy responsibility to these children. I want to thank you for exercising the leverage of partnerships with states, localities, local organizations to make sure that we do take as good a care of these kids as we can. Thank you for your hard work, and if we can be helpful, let us know. I yield back.
And thank you to you when we were in San Diego with those facilities.